On this week's episode, we're going to be talking about elbow pain and how to strengthen that joint. I am the marketing director of the Springfield Wellness Center. Today I'm going to be talking with Dr. Rob about typical elbow pain that we see in the office. So what kind of elbow pain do we see in the office, Dr. Rob?
We'll either usually see like an acute traumatic injury where someone they knew exactly what they did when they hurt their elbow, or more commonly we'll see more chronic things that really come from like overuse of the elbow and hand and arm, things like that. So
would you say that it's more athletic or more people that are in the office that are using their elbows quite a bit?
A little bit of both. I mean, athletes you'll see will generally have like the more acute traumatic things from say like lifting injuries, things like that. Whereas the majority of the population who just, they're on their computer a lot, you'll see those kind of show up a little slower. That's when the problems will kind of set in.
So you would say that pretty much anybody's at risk for any type of elbow pain?
Yeah, anyone who uses their arms.
Yeah. What kind of treatments do we have in the office?
With elbow pain, we can adjust the elbow. We'll do some soft tissue work with like Graston. Laser's helpful, and then there's some exercises we could do as well.
Okay. And I know after Rainey's Fitbit here, we're going to be practicing Graston
We're going to work on the elbow
on me, and we're going to also talk about laser. We do have a PDF attachment called the, what is it?
It's called a flex bar, where it's essentially, it's really for like grip strength and lower arm issues.
Yeah, so it's an awesome tool for helping kind of strengthen around the elbow and kind of prevent, I guess, further injury, or just making sure that you're keeping from injury. So we're gonna take a quick break. Rainey's Fitbit is up next.
Hi, I'm Rainey. Welcome to this week's Fitbit. This week we're talking about elbow injuries, specifically golfer's elbow and tennis elbow. Most people don't realize that you don't have to golf or play tennis to have that type of injury. What that is like overuse of the elbow, and it's going to cause inflammation in the elbow joint. And the difference between the two is that tennis elbow is actually more pain on the lateral side or the outside of the elbow, and then golfer's elbow is in the medial or the inside. So what I'm going to do today is show you a couple stretches and then a couple exercises towards the end. So the first thing we're going to do is stretch it out. We're going to do just flexion first. So we're going to have our palm up, arm out straight, and you're just going to kind of like gently pull your fingers downward. So we're stretching through the forearm here. So just kind of holding it there for maybe 15 seconds or so. And then relaxing. You want to do that a few times to really get those stretched out. And then we're going to stretch the extensors. So we're going to put our palm down, and then we're going to press down that way. So this time we're going to feel it more on the top there. Doing it the same way where you hold it for a little while and relax. But make sure you're gently pulling, you're not pushing too hard. All right, so then we're going to move to the exercises. So you can hold a weight if you want, or even like a soup can or something with just a little weight. Start light at first, especially if it's been hurting. But what you're gonna do is you're gonna rest your forearm just like on your knee like this, with your hand over, over the knee. And first we're gonna do flexion. So with the palm facing up, you're just gonna kind of like curl your hand towards you this way, and then back down, up and down like that. So you're gonna do about 10 times. We're working the forearm muscles again. And then we're going to do extension. So we're gonna flip the palm down, and we're still gonna curl up. So this one's a little harder. It's not a very natural motion to do this direction. Again, you're gonna do 10 of those, just like so. Then we're going to change and move the weight so it's in an up and down position. And we're gonna do pronation. So what this is you're going to turn your wrist. So this is keep it vertical, and then we're gonna turn your wrist so that your palm is going down and then up and then back down. So you'll do that one 10 times. And then we're gonna do supination. So this one, we're gonna turn it until the palm is up and then go back to neutral and then back down, up. Again, we're gonna do 10 of these. All right, and then the last one is just radial ulnar deviation. So again, the weight is vertical, and then you're gonna do kind of like a hammering motion. So you're going down slowly and then bringing it all the way up slowly. This one is, again, not like a natural motion to go up. So just do it very carefully. Just down and then up. Again, 10 of those, just like that. All right, so one more thing I'm gonna show you here. We have kind of like a little tool in the office that we use. We actually made this ourselves with just some PVC pipe and some rope. And what I've done is I've strung the weight at the bottom, so it just kind of makes it a little harder. You're gonna hold your arms out straight, and I'm gonna roll the rope up so that the weight is coming up towards me in this way. And then I'm gonna go back down. So I'm getting flexion and extension going up and then going back down. And then you can do it a few times. It is pretty hard. It's not the easiest thing. Just like that. All right, so another thing I wanna mention is if you are having a lot of pain, this is an injury that you don't want to like push through the pain and get right to the exercises and try to work it out. It's something that you need to rest it until you're out of pain before you do anything like this, because if you start to push through the pain, you're going to take like 10 steps back, and it's only going to cause more inflammation and more pain. So wait until you're ready and rested before you start to strengthen or do these exercises. All right, and that's been this week's Fitbit, and we'll see you next time.
So what we're going to do, we're going to show how we would typically treat some of these issues in the elbow. Now, if it was more of a tennis elbow, we're going to find more problems out here on the outside of the elbow. Golfer's elbow we'll find on the inside, but we'll occasionally find some in the tricep as well, just from overuse activities. What we're going to do with Brooke today is we're going to work mainly like she had tennis elbow. We're going to put...
And I would tell you, this is not supposed to feel like a massage. This is
not necessarily.
Feels fairly intense, right?
Yeah, it does.
Yeah,
I mean, because it's just a matter, you're just trying to really break up a lot of the scar tissue in the area. And so with her, I mean, she doesn't necessarily have too much of an issue, so I'm not really going to go real hard on her. But you just kind of take and you just kind of scrape along with the tendon to really start breaking everything up through there. Does that feel okay?
Yeah.
Is it sore?
It's sore.
Okay.
And do you have, I guess, would bruising be normal or not?
It can happen. Usually I like people to do ice like right after this to kind of cut down on any potential bruising. You got a little spot right there.
Yep. And how long, if you were doing, I guess, a treatment, does it last?
Like in
Doing
between
Graston.
like sessions?
No.
It's more a matter of, each treatment kind of builds on the one before. So it's like you have to kind of slowly break everything down. If you try to do too much too fast, you'll definitely bruise people and make them pretty sore. Usually if I see people kind of starting to turn pretty red after going over it, that's about when I'll stop for the day, just to, again, prevent a lot of bruising from setting in. Does that feel okay so far?
Yeah, that feels pretty good. So what are you feeling for?
So when you're going over it, you feel like these little like gravelly spots where that's where the scar tissue is, and you're just, once you find those, you kind of have to focus on them really.
I can definitely tell those areas a little more tender.
A little more tender. But usually elbow stuff, it's not as bad as some other spots. Like IT bands are a little bit more sore in general, but. So that would probably be all I would really do with her for the elbow now. So I think next we're going to go ahead and do laser with her. Alright, so now we're going to start doing laser on Brooke's elbow. And what we're going to do, essentially we just have the laser head and we just kind of work all around the joint. So similar to how we were doing with Graston, we can kind of feel some tight spots. You can kind of take and work on those a little bit more. But with this, we're really trying to just do more like all over the area. not necessarily spending as much time focusing, because you really want to get everything through the joint. So we'll work back here a little bit. Okay.
Yeah. No, it honestly, I mean, do people typically feel like it's warm, or it doesn't even really feel warm?
Not necessarily. With the heads where you're kind of back and just shining light on it, feels a little warmer. With this one, you generally don't feel a ton of heat change. So.
Yeah, and the glass and the light is why we have these really cool glasses on.
Exactly.
Yeah.
It'll burn your retina, so I'd rather not do that.
And how many treatments?
With laser, it kind of depends person to person. A lot of times I'll kind of only really plan out like 6 at a time, maybe 3 times the first week, twice the second week, and then down to once the following week. In most cases, things are pretty well resolved by that point.
So if I've incurred injury to my elbow, this would be something that would be a great treatment plan. What if I've had elbow surgery, like recovery?
It should be fine, because it has a really powerful anti-inflammatory effect. So the more we can get inflammation out of the area, the more the tissue can heal.
And how long does a session typically last?
With elbows, it's a little smaller. These can be like 2 minutes.
Yeah.
So this part's usually pretty easy.
All right, so we finished our 2-minute session on laser, which felt great, especially for moving to Graston. The laser, I would definitely, as I say, I definitely like the laser a lot more. Make sure to check out our video website, WellnessLab.tv. We have other episodes of different subjects, topics that we've talked about. We also have a YouTube channel that has a lot of short videos on it. Make sure to check that out. It's the Chiropractors at the Springfield Wellness Center. We also have a PDF on the
Flex bar.
So different exercises to help you kind of strengthen that elbow joint and to prevent further injury. We'll see you next week.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at WellnessLab.tv.